Good afternoon. You're listening to the new WCEG Network on WCEGTalkRadio.com. Click your live stream tab or watch us live on your smart TV. YouTube at WCEG Network. I am Celeste Giordano, your show host, and this is Global Legacy and Wealth Building for the next hour. We're the worldwide community empowerment group where we speak life into the community. Like us on Facebook, follow us on Twitter, and on Instagram at WCEG_talk_radio and at WCEG Network. And last but not least, our disclaimer, the topics and opinions are those of the show host and guest and not WCEG Network. And thank you for your continued support. And thank you, Penny Rogers and the entire board at WCEG Network for this opportunity to have a platform for global legacy and wealth building. We are getting down to the final few shows of 2022, and we are so excited to have the opportunity to have Bonnie Dobbs with us. This is our third time, I think, in 3 years that we've had her with us, and she is the queen of Medicare and cutting through the red tape of all the things that we go through. And Bonnie, I would just like to welcome you to our Global Legacy and Wealth Building. So we're glad to have you today.
Thank you. Thank you guys for having me back for a third time. This is exciting always to be on your show.
Absolutely. And I know it's crazy all year long, but it's super crazy right now during open enrollment. And I'm sure you're going 150 miles an hour. But for our listeners and audience, I know we've had you for 3 years. Every year at this time, because you are our go-to person that has to do with Medicare and other red tape. And last year, I remember that our veterans were so appreciative of all the information that you had with TRICARE. But why don't you tell our listeners and audience a little bit about yourself and how they can get a hold of you, please?
Yeah, sure. So I was honored from 2015 to 2020 to sit on all the panel discussions as the Medicare expert for the AJC's Aging in Atlanta panel discussions. And then, of course, in 2020, whenever COVID shut down America, they asked me to write articles. So since then, I usually write about 2 articles a year, probably like in March and then again in October about Medicare. And what I do is I just collect questions, some common, some uncommon questions, and I expand on those answers for everybody because we hear so many half-truths about Medicare. So I try to make things as simple and possible whenever I'm writing these articles so people do understand them, because Medicare is so confusing. And then in the beginning of this year, the National Aging in Place Council selected 20 experts across the country to write a book. And they chose me to write the portion on Medicare. So the book was released at the very end of September. And the name of it is Aging in Place Conversations, What Industry Experts Have to Say. And it's available on Amazon. And what it covers is the National Aging in Place have what they call 5 pillars or 5 different areas that people need to think about and to take into consideration, as you age. So this book, it doesn't matter if you're there now or if you're a caregiver or if you're 30 years old, because it addresses thinking about where do you want to live, transportation, health, wellness, personal things like finance and insurance, community, social interaction, So it's those conversations that you need to have with yourself, and then also, with your spouse or your family. So I'm just very grateful to do that. And of course, I do seminars year round and in Zoom classes. So there's always an opportunity to hear me speak either in person or, on a Zoom meeting. And so thank you once again for having me on this podcast.
Absolutely, Bonnie. And first and foremost, I want to say congratulations are in order for you are now a published author. And I can't wait to get my hands on this book. So I'm sure it's filled with chock full of gold nuggets, as you said, of the things that you just talked about. Is there anything else that you would like to say about this book that specializes in Medicare in the first place?
Well, because there were 20 authors across America and they each expanded on their area of expertise, we got about between 8 and 10 pages of to write our information. So what I tried to do was put as much information as possible in that little space, but what I put was good general information that's not just for today, but even if you read this book in years to come, it's some of the foundations of Medicare, the basics that everybody needs to know.
Absolutely. And I appreciate that. So look forward to getting that. And again, congratulations on being a published author. So let's roll up our sleeves and let's get to work on what's happening right now into the Medicare. And we're also going to be talking about what's happening in 2023. There are so many different commercials on Medicare today, all promising low rates. Our mailboxes are full with mail that's coming about Medicare and things of this nature. How does a person know who to choose and what to choose?
Yeah, you're absolutely correct. All those crazy TV commercials. I mean, to begin with, there's already many misconceptions about Medicare, and senior adults are bombarded with TV commercials, aggressive marketing companies, agents calling, texting, email. I mean, even think about it. Your family and friends try to give you free advice. One of the things that is the scariest is somebody's family or friend will say, look, I'm on this plan. This is the best plan. You need to be on this plan. And they think because that person has some knowledge or has been on that plan, that that's a great plan for them. But the thing about Medicare is Medicare's all about you. So the plan that could be the very best for you could be the worst plan for your husband or your sister or your next door neighbor. So everything is all about you when it comes to Medicare. So there is no one company, there is no one plan that is a one size fits all. And sometimes people ask me, what is better, a Medicare Advantage or a Medicare supplement plan and a standalone drug? Well, guess what? All of these plans were made for some individual, but once again, there is no better way for me, for you. I mean, there's no blanket statement. Let's just put it that way. I can't just say, this is the best way to get your Medicare insurance, or this is the best company, or this is the best plan. And so whenever I hear people, or I do understand when people get so bombarded, they are confused. So that's annoying. Yeah.
And that's so true, Bonnie. This past weekend, my husband and I were up in Nashville celebrating an engagement party for somebody that's very, very near and dear to our heart, our best friends and their daughter. And so there's a group of us, and I don't mind saying I'm 66 and a half, be 67 in March. And so we're all within that age group, give or take plus a few years or minus a few years. And this conversation came up about Medicare. And so, and a good example, and maybe you may want to expand on this, is one of the people that were with us is retired and from the Gwinnett County school system. And so, as you know, with the school systems that they have health benefits with, and then they covers their spouses. But when their spouses age out into signing up for Social Security or whatever it is, they no longer can be on that Advantage plan or whatever. I guess they have to go to a supplement B or something, right?
Well, first of all, whenever somebody has an employer plan or a union plan, or what they should do is always contact a broker. And I'm going to go over that a little bit later on, because whenever you first become Medicare eligible, there's some important things that you need to know. So this just is another good example, though, of how somebody that's totally uneducated in Medicare can end up doing the wrong thing right out of the gate. But let me really deep dive into that later on in the conversation. But people that are on employer plans or union plans, if they don't understand what they're doing, they can lose that plan forever. So
Yes.
yeah, so there's certain things that they need to know. And that's one thing we do, is we educate our folks on what to do and when to do it.
Absolutely. I mean, because so many times, I mean, like I said, this conversation came up this weekend, and I mean, I laugh because, I don't look at myself as being old, retirement or whatever. My husband and I still very young and vibrant and want to continue to work because we enjoy what we do. And we're fortunate that we have insurance through my husband's employer and things of this nature. But a lot of people really don't understand that they may talk to somebody at Social Security or whatever, and they need to have several conversations with the right people, because not everybody knows what's really best for you unless it's just like having a financial advisor or anybody else. You need to hire an expert to help you make these decisions.
Absolutely. I strongly agree with everything you just said.
So anyways, what are some of the most important changes you see coming up in 2023?
Well, actually, there's two major changes coming up. And these first two that I'm going to go over is all because of those crazy TV commercials. I should call them misleading TV commercials. So I hope nobody ever calls an 800 number that you see on TV. Please do not do that. Those people do not have your best interest at heart. So the first one is, starting this year on October the 1st, every time I speak to a client, I must record that conversation, and it has to be kept for 10 years. Now, anytime you've ever called an insurance company in the past, it's always been recorded and they have to keep it. But now, because there's been so many complaints because of the TV commercials, even agents have to record these. And that is very annoying to me and to my clients. I've been doing this for so long, and I have been blessed with so many friends. So, I mean, sometimes at the end of the conversation, we're talking about when we're going to get together and meet for lunch, or, see it in January. Yes, we are going to have that glass of wine. I mean, but, and then I totally forget. I'm saying, oh, how's your kid? Or not your children, but how's your grandchildren usually, or something like that. So this is very, very annoying. It's like the clients and the agents who are trusted, like, we are being punished for this. And then there's this disclosure that has to be read either personally by the agent, or you can play a recorded message. And you have to do this within 1 minute of starting a conversation with your client. And it starts off saying, we don't offer all plans available in your area. If you want all plans available, call Medicare.gov or 1-800-Medicare. Okay, let me tell you the reason why, because there's always a reason for everything I do. Okay. The reason why I do not offer every plan in the area is because, number one, there may be plans that have been in business for like 3 years or less. And I have got burned, and my clients have gotten burned, not once, but twice, with that happening. Once whenever I was living in Florida, and once in Georgia. So what happened was a new company came out. They're offering the sun, moon, and the stars if you enroll with them. So these aggressive marketers talk us agents into, contracting, and I sign people up, and guess what? They go out of business. They may go out of business in 3 months. It may be, during the year or whatever. And what happens to my clients if they're in the middle of getting a procedure or something? They're going to be really upset if all of a sudden their plan is no longer available. Maybe they can't go to their doctor who's getting ready to perform this surgery. They're going to be really mad at me because they depend on me to do the best for them, to put them in a plan that's stable, with a company that's stable and it's going to be there. So that is the reason. And then there is one drug company, and I think that's the only other one in our particular area in Georgia, that they have what is known as captive agents. And what that means is they do not offer their product to field agents. That's what we're called. A captive agent only works for that one company. They cannot compare all of the other plans that's available. So, I don't offer that plan because we're not allowed to offer that plan. And so it always makes me wonder what are they hiding? Why don't they want their plan compared with all the other plans that's available? So there is a method to my madness, but I really hate having to read this personally or play that recording every single time I talk to clients, because unless I go through this whole dissertation, like what I just did with you guys, I'm sure they got it in their head. Well, so why isn't she offering all those plans? I can't tell 1,000 people that, in a short amount of time, because after all, there's only 60 million people on Medicare. So those are two things that affect the client and us as agents. Okay. So it must be recorded, and we have to state make that silly statement. Now, something good, but it's kind of delayed, is the Inflation Reduction Act was passed, and what they're going to be doing is reducing the cost of medications over the next few years. So the good news for 2023 is we're going to have zero for vaccines. That's right. That includes that expensive shingles shot, and you have to get two, those are like $230, $280 a pop. So starting in 2023, vaccines will be zero copay and $35 for certain insulins. A few of the companies started doing that last year, but now all of the companies, because it's been made law. For next year, in 2024, medications are going to be capped at $3,400. So regardless of how much your meds cost, the most you're going to pay out of pocket will be $3,400. And that is such a welcome for so many people.
Absolutely. And that's in 2024, Bonnie?
Yes.
Okay.
Also in 2024, they're going to increase the eligibility for those of low income. It's going to going to increase to 150%. And then they're going to put a cap of 6% on annual increases for Part D premiums, because the two ways to get a Part D, which is a prescription drug plan, is either it's built in your Advantage plan, or if you get a supplement plan, you have to buy a standalone. When you have to buy a standalone, you have a monthly premium. So they are going to cap those starting next year and not allow more than a 6% annual increase. I know year before last, I had a company and they were just grandfathering people into another plan because they were going to cancel a certain plan, and the plan was like $30 a month, and the plan they were grandfathering everybody into cost $60 a month. Well, how do you call everybody that's in your book of business and say, hey, you may get a 100% or double your increase? It was just absolutely crazy. So I'm glad they're going to be doing that. And then in 2025, they're going to cap all meds at $2,000. So it doesn't matter what your meds cost. In 2025, they're going to cap it at $2,000. And they're going to also allow the cost to be spread over a 12-month period. So you could pay I think it breaks down to like $167 a month or something like that. So that will be good. But there's so many people that are hurting right now. I really hate that that's 2 years away. And it also causes me to have pause because in 2018, they told us that the donut hole was going away in 2020. Well, guess what? Here we are, 2022, and we still got that darn donut hole. So I don't know if they didn't even mention that. I don't know if that will go away because of the way they're going to cap the meds the next couple of years, or what's going to happen with that. But at least there's some relief coming soon.
Well, that was a question that I had, that you're talking. I can understand talking 2023, but then you're saying this is what to expect in 2024, this in 2025. Can any of that 2024 and 25, can that change by that time, or is that in concrete that will take place?
That is a good question. And that's the reason why I said this causes me pause, because they told us in 2018 that the donut hole was going away, and it didn't. So who knows? Now, a few of the following years, and I can't remember exactly how far it is out on the information that I read, but they're going to add like 10 drugs one year, 15 drugs the next year, and 20 drugs the next year, where they're going to decrease or prevent any annual increases on those medications. Because an example, and you can probably Google and find this, I just read where starting next year, there's 10 medications and they are going to increase the cost. And some of it, well, to me, it doesn't make any rhyme or reason, because one of them is lisinopril. Lisinopril has been on the market how long? And it's such a common medication, and it's a tier 1. I don't know why they decided all of a sudden out of the blue, they're going to increase lisinopril. That's one of the drugs. The other one is Eliquis. Oh my God. Eliquis, there's not even, I don't even think it has a generic, and it's very expensive. And if you need that medication, I mean, it's already a tier 3 drug. And for them to increase it, I don't know. It's not right. But those are the two that stick out in my mind about that. Some things for next year also that have to do with drugs is this year, the most a drug company, or if you get, whether you get a standalone drug or get it in your Advantage plan, the annual deductible, the most you could charge was $480. They're increasing that to $505. So what that means is, for most plans, if you are on a tier 3, 4, or 5 drug, you have to pay the full cost of the drug till you meet that $505 annual deductible. Then you revert to your tier cost. Well, I mean, that's just adding insult to injury. 480 last year, 505 this year. I mean, honest to God, when I first started doing this, I don't remember deductibles. And then I remember they were like $50 a year or $75 a year. But now in 2023, it's going to be $505.
$5.
Yeah, if you, depending on the, what tier your drug falls in. The Part A deductible is going to increase this year. And Part A is for hospital. It's $1,556. So if you only had original Medicare and you went in the hospital every quarter, you'd have to pay $1,556. For starting in 2023, they're increasing it up to $1,600. So that's a it's not a big bounce, but it is an increase. Now, the good news is the Part B premium and the Part B deductible is going to decrease. So in 2022, the Part B premium is $170.10. So if you had started your Social Security, they deduct that monthly from your Social Security. But if you are delaying Social Security, you have to pay quarterly. So let me back up for a minute. The way you get your Part A is by working and paying into Medicare taxes known as FICA. Once you've worked for 10 years, which is equivalent to 40 quarters, whenever you become Medicare eligible, you do not owe any more premium for Part A. So you pay Part A during your working years. You have not paid Part B. So when you become Medicare eligible, there is a premium and it also has a deductible, just like Part A has a deductible. So for 2022, it's $170.10. For 2023, it's going down a few bucks. It's going to be $164.90. Yay!
Yay.
Okay, so the Part B deductible for 2022 is $233. It's going to decrease a couple of bucks. It's only going to be $226 in 2023. And so this is going to be the first time a reduction in Part B premium and deductible since 2012. And I just started a little bit before that. And hey, guess what? With COLA having an increase of about 8.7, there may be enough extra left over for everybody to go buy a sandwich, right?
Absolutely. Bonnie, I want to pause for a minute for our listeners. We are live streaming live on social media and YouTube. And what I'd like for you to do, if you have any questions for Bonnie or I, is to put them in the chat. We have someone monitoring the chat, and we will be glad to answer any questions that you have. And Bonnie, do me a favor and go ahead and tell people the name of your company and how they can get a hold of you at Medicare and Other Red Tape, please.
Sure. So my name is Bonnie Dobbs, and the name of my company is Medicare and Other Red Tape. Our phone number is 770-373-7541, or you can go to the website, Medicare and Other Red Tape, or if that's too long for you, you can just go to you can just go to bonniedobbs.com.
There you go.
Make it easy.
Make it easy for yourself. So is there anything else coming up in 2023 that you want to share with our listeners?
I think that's about all for right now. It's mostly surrounded, about with the Inflation Reduction Act and the crazy commercials, those two things. And so the good news is, the Part B premium and deductible is going down and COLA is going up. Long-term medications there's supposed to be a cap, so that sounds good, but hey, stay tuned, right?
Absolutely. And talking about medications, and you may have a comment on this. I happened to go to the drugstore today to pick up our medication. My husband and I are very, very limited. We each take something for our cholesterol, but they are not consistent in what they charge every time we go. And so a lot of times they'll say, well, this is all that your insurance provider pays. I said, no, it's not. I only pay this. And so I had this conversation with the little lady, and she just, they've got so many young techs in there doing things, and God knows we appreciate them and that they're working and things of this nature, but they don't always know the good, the bad, and the ugly. And I disagreed with her. I said, that's not what I pay. And she said, well, that's what it is. I said, no, it's not. She said, well, that's what it is. I said, put the pharmacist at the window. And he came and he went in there and he went to the computer just like she did. And he said, you only owe $3. I said, thank you. And she wanted to charge me $60 for this medication. So for the people listening, be aware that when you go in there, you've got a lot of young people learning and training and things of this nature. And if it's not right, a lot of people just pay because they get frustrated. Don't be afraid to question and know what you pay for your medication, and don't be afraid to stand up for yourself.
Absolutely. And to add to that, I know this sounds crazy. Even though you have to have a Part D or a prescription drug plan in Medicare, or you get a lifelong penalty, you don't have to use it. So anytime you go to pick up your meds, always ask, is it cheaper with one of the discount programs like GoodRx or Mark Cuban's, I can't remember the name of it off the top of my head right now. And if it's cheaper paying cash rather than using your insurance, by all means, that's the right answer.
No.
And then the other thing that you're talking about, though, one of the things about Medicare and the reason why in Medicare, your medication, it could cost 4 different prices over the course of the year because of the donut hole. Because remember, I was talking about earlier, if you're on a tier, and usually it's a tier 3, 4, or 5, there is a couple of plans that start with tier 2, but you have to meet the deductible.
Yes.
Okay. So if you had to meet the deductible, that would be one specific cost. Then you go into the tier cost, okay, in the initial coverage stage. And in that, you pay, in the initial coverage stage, you pay your tier cost depending on where your drug falls. So then what they do is they add your copay with what the insurance company pays. And for 2023, if those two figures add up to $4,660, then you go into the donut hole, which is properly named the coverage gap. In the coverage gap or donut hole, you pay 25%, whether that drug is a generic or a brand. Now, if you pay up to $7,400 out of pocket, then for the remainder of the year, you pay the greater of 5% of the cost of the drug, or $4.15 for generic, and $10.35 for brand. So when you're on Medicare, depending on where you are with the donut hole or with the different coverage phases, you could pay 4 different amounts. And that is the reason why people at the counter, at the drugstore, whenever they're paying for their meds, they get totally bent out of shape because whoever went over their drug plan didn't explain it to them. And I'm not going to know what that magic figure is because I don't know, you may not be on the same medications that you were whenever we went over your plan and I told you what your different tier cost was going to be, because tier cost is usually what that dominates whether you go into the donut hole and into the different phases or not. If you're like on a tier 1 or 2, you're probably not going to get in the donut hole, or maybe if you're only on maybe 1 or 2 tier 3s. But if you're on some expensive tier 3s, 4s, or 5s, you're gonna have to pay those costs. That's the reason why in 2023 and 2024 and 2025, those caps it's so big for those drugs.
Absolutely. And, and I only do name brand drugs because I only have 1 kidney. So I only do name brand drugs. Mm-hmm. And like you say, we have Cadillac insurance, but they do have these coupons, this or that. And the lady said, well, your coupon is expired for this particular name brand drug. I said, no, it isn't. It just, it just started in September. And like I say, the pharmacist got on there and he said, no, you're good. So you just have to be careful. And I mean, some people, I could just see an elderly person just say, fine, I'll just pay you what it is. And I knew it was wrong. So you have to speak up for yourself.
You have to be your own best advocate. You're absolutely right. And good for you for hanging in there and knowing, that you did have a coupon and what the real cost was. Because like I say, some people, I know this is hard to understand, but they really, really need to take the time to understand it whenever they're going over with an agent who can explain it to them. So whenever they are at the counter, they'll know whether they need to do exactly what you did or say, okay, yep, you're right. This is what I do. Because nobody wants to get into a fight unless you have to, but we all have to take up for ourselves and, like I say, be our own best advocate. So good for you.
Well, let's move on, Miss Bonnie. We know that we're in the annual enrollment period now, and can you explain that? And are there other times when a person can enroll? And last, what about when they are first eligible for Medicare if they work past age 65 and are getting ready to retire?
Oh, yes. Great. So right now is called annual enrollment period. And so if you're on a Advantage plan, you can compare the plan you're on with all the other plans that are going to be available for next year. If you would like to check into a supplement plan, remember with supplement plans, you do have to medically qualify. So you would want to have an agent send in an application for your supplement plan to see if you do medically qualify. If you do, at that point, then you would need to enroll in a drug plan. Also, during this time of year, if you're on a drug plan, you can compare every plan that's going to be available for next year. So you can move from an Advantage plan to another Advantage plan, or if you want to go to a drug plan in original Medicare, which I would never suggest anybody doing that, but some people do, then you can compare drug plans. But if you want to go to a supplement plan, you can do that. You can actually do that any month that you medically qualify. Like if you're on a Medicare supplement plan, then you can any month put in an application if you want to change that plan. And as long as you medically qualify, you can. Because when you first become Medicare eligible, you can get on any supplement plan with no medical underwriting. And then there's a grace period of a year. After that grace period is up, then you have to medically qualify. So it's really important to talk to an agent that can educate you to make those decisions. So during this time of year, all 60 million people are trying to decide, should they stay on their current plan or do they need to move to another plan? One thing that's important that may help them decide is during the month of during the month of September every year, if you're on an Advantage plan or a drug plan, you'll receive a document in the mail, and the name of it is Annual Notice of Coverage. Now, what the Annual Notice of Coverage does is it goes down line item by line item and compares the current year with the year coming up. So it'll start like if there's a premium or deductible, and then the benefits and go down. So if the plan that you're on, you have enjoyed it and maybe things haven't changed, like you're still on the same medications, you haven't moved, you still going to the same doctors, then you may want to just do nothing. And if you do nothing, your plan will just roll over. But if your medications have changed, if all of a sudden they're you're paying a lot more for your medications. If your plan's monthly premium increase or annual deductible, if it has one, is shooting through the roof, then now's the time to check that. And then some other times outside of open enrollment is, hey, every day somebody turns 65 or retires after 65. So you don't have to wait to wait for open enrollment to enroll in Medicare. Whenever you become Medicare eligible, you can do that. We always like to start working with somebody 3 months before. That way we can give you guidance, step by step, hold your little hand, take you from regular insurance into the wild, crazy world of Medicare. So another time is when people move. Now, one of the things that's very confusing about Medicare is Medicare is a federal program, but did you know it differs state to state, county to county, and some plans literally zip code to zip code, especially in some states like Florida. Okay. So anytime you move, I don't care if you move across the street, you should call a broker and have them compare all the plans in your new service area. Because if you move and you don't change plans and your plan is not in that service area, you're going to get a penalty and you're going to pay a lot more for your insurance coverage. So just remember, guys, if you're moving, give us a call so we can make sure you're either good to stay on the plan that you're on, or sometimes when you move, it's a good thing because your new location may have some better options.
I did not know that.
Yeah.
So anytime you move, if you're enrolled, you need to get with a broker like you, and you do have to register or check with Social Security or anything?
Absolutely. But I like for people to talk to me first.
Yeah.
Before they call Social Security and Medicare, because once you move, there's a clock and it's ticking. And there are rules about when you can enroll.
Okay, that's a very good point.
Yeah, and change plans whenever you move. So another time, Celeste, that you may not know is if you're going in or out of a nursing home, because if you're going into a nursing home, it's probably not because you're having a good day and your health has changed, your needs have changed, maybe your medications and your doctors have changed. So the federal government does give you a one-time option when you're going in to change plans, and the same thing when you're coming out. So you go in and they take care of you and you get all better, and now coming out again, maybe your medications have changed again. Maybe your doctors have changed again. Maybe you're going to move to a different area. Okay. So whether you're going in or coming out of a nursing home, skilled nursing home, you have the option to change. If you qualify for a low income subsidy or a Medicaid, or if you're losing low income subsidy or a Medicaid, and those are all income based, that's another time whenever you can change. There are plans specific for people who have chronic conditions. Now, the chronic conditions differ in each state. So for the state of Georgia, it's heart problems and diabetes. So if you do have one or both of those, then being on a chronic plan would allow you to, they charge you less for those medications, okay, whenever you're on those plans. And then there's plans specifically for people that are on Medicare and Medicaid. And oftentimes people will say, well, I'm on Medicare and Medicaid. I'm already not paying for anything. But if I can get you some more benefits, like that's where those commercials come in, the dental, vision, and hearing, and the over the counter and so forth. those plans were created just for low income, and which will take me back to what we talked about originally whenever we were talking about those commercials. So all those commercials that you see on TV, they are geared towards about 10 to 15% of the population. And they stand up there and make all these promises, like they're going to have dental, vision, and hearing and give you a pink Cadillac and a trip to Disney. I mean, come on, that's, if it sounds too good to be true, it probably is.
It is
good to be true. So, so just know, don't ever call one of those 800 numbers on TV. I mean, do yourself a favor. What they're going to do is, I don't care what plan you're on, they're going to discredit the plan that you're on and try to get you to enroll in one of the plans that they offer. So, and they don't care if you're on an employer plan. If you're on an employer plan and enroll in an individual plan, guess what? You have lost that forever. They're never going to allow you back into the nest. If you ever do that, now you're out, and they're not going to say, oh yeah, we want you to come back over so we can pay for your insurance the rest of your life. Not going to do that.
Yeah.
Okay. So you will lose your employer coverage. Now, there may be some times when it makes more sense to enroll in an individual plan, but you need to talk closely with an agent who is very well versed in that type of situation and who can educate you. And if you don't understand it, then you don't need to be doing it.
Absolutely. So Bonnie, what about if you work past age 65 and you're getting ready to retire?
Yeah. So if you work for a company that has 20 employees or more, then that company has what is known as credible coverage. So as long as you work, then if they are providing your insurance less than you can get it, an individual plan, then you should absolutely stay on. I like to talk to people that are turning 65 and have that option, because if what their company offers is more coverage at a lesser cost, I always say stay where you are. Me, and I teach all of my agents the same thing. We are very, very honorable. You can trust us because we're always going to do what's right for the client. Now, if you call one of those 800 numbers, they're going to just put you on a plan, whether you lose your coverage or not. They don't care. That's just their goal. Okay. But going to a reliable company that comes from a place of integrity, we're going to compare what you have with what is available. And if what we have serves your purpose, so you get more comprehensive coverage for a less monthly premium, then every time we're going to tell you the truth about everything. But if your company insurance or your retiree plan has better, then we're going to tell you that also. I have people sometimes say, well, but I want you to be my agent. Well, you know what? I want to be your agent, but I'm always going to do what's best and what's right for you. And we have people refer clients to us that we didn't write because they really needed to stay on the plan that they're on, and we were honest with them about it. So that's important. And once again, we like to start working with people 3 months before. So if you're continuing to work past 65, whenever you come up with that magic date in your mind, then give us a call. And so we can, like I say, hold your hand and help you step by step. There is one more time when people can change plans, and this is so important. So originally, a couple of years ago, they tried it for a year, and then the next couple of years, they didn't do it. And now it's been back for a couple of years. So listen up. Now, this is for people who are on Medicare Advantage plans only. So if you're not on Medicare Advantage plan, this does not apply to you. But if you are, they decided to give you the opportunity to take that Medicare Advantage plan for a test drive. So you can change plan, Medicare Advantage plans only, from January the 1st to March the 31st in 2023. Okay. I don't know if they're going to continue doing this every year or not, but during annual enrollment, which is October the 15th to December the 7th, you compare all the plans that's available to you and you make your decision. However, after January, when you can actually use your plan, maybe that plan is not doing what you thought. Maybe somebody, told you some things that were not true. Maybe your medical needs have changed, your doctors or your medications or whatever. But just remember, for Medicare Advantage plan people only, you can change that plan. You have a one-time option from January the 1st to March the 31st to change your plan.
Absolutely. And Bonnie, I want to thank you so much for helping Mike and I when we turned 65 last year. I mean, you gave us clarity and insight. We had spoken with Social Security, a few other people, but you were on point and so precise. So thank you so much for that advice. We have about 8 minutes left in the hour, Bonnie. What is the advantage you provide to clients as a broker versus an individual agent? And how is that you can offer your services for free?
Yeah, people often ask me that. So we want to provide personal service and we want to find out about you, because finally, for once in your life, it's all about you. Medicare is all about you. So there's several different areas of criteria that we take into considerations. Number one is, what are your needs? Okay. Where do you live? What is your lifestyle? Are you running off to foreign countries and spending a month or two here and there? Or are you never going to leave the county that you live in? What is your current health? Are you in good shape? Are you going to the gym? Or do you have poor health? Or have you been diagnosed with something and maybe you're going to have a hip replacement coming up? Or, maybe you've had some tests and you haven't gotten the results back. What is your health going to look like down the road? And then, of course, the other normal things like, where do you live? What doctors do you see? What doctors would you like to see? Do you want to go to the Mayo Clinic? Actually, the Mayo Clinic just released something yesterday. I think it was yesterday or day before yesterday that I was reading on Google News, because that's where everybody gets their news these days, right? And they were really trying to educate people on the difference between an Advantage plan and a supplement plan, because the way you have your health care administered depends on where you can go and what in these. Every provider is in a position to accept Medicare, or they don't have to. Or they can accept Medicare and they can accept certain plans. They don't have to accept all of them. So the provider, and that's regardless if it's a hospital or a doctor or an imaging center, they all get to choose if they're going to accept original Medicare and which of the plans that they're going to accept. So it's important that everybody understand their coverage. And one of the things that we always like to do is, especially to people when they first become Medicare eligible. So whether you're turning 65 or retiring after 65, and there's also another group that I did not address. There are people who are under 65 and they have become Medicare eligible because they've had an injury or health issue. So say people have a motorcycle accident, or my nephew has MS and he's under 65. So those are the 3 different times when you become Medicare eligible. In all of those 3 different times, there's different rules. Example, if you're under 65 and you have been on disability for 24 months, in the 25th month, you are guaranteed, you are awarded Medicare. So then you can get on a Medicare plan. That's really important. So we provide personal service to everybody and find out what's important to them.
Well, is it also true, Bonnie, and we've got about 4 minutes, as a broker, you have multiple different options with different insurances versus an individual who primarily maybe works with just an individual insurance, correct?
Absolutely. And that goes back to calling those 800 numbers on TV. So if you call a company specific, they're going to enroll you in whatever they have in their portfolio. They are not in the position to compare all of the plans in your area. They can compare the plans that they offer, but working with the broker, we're contracted with all the major companies, plus some you probably never heard of before, okay? So we can compare everything that is available in your area.
Absolutely. Now we have a customer just wanted to thank you, Bonnie, for guiding them through the process until they understood Medicare and the other red tape. You definitely gave them the gentleness, the kindness, and the love of getting them for the understanding. So we have about 2 minutes, Bonnie, and I want to thank you so much for sharing with us today, because you always bring us a wealth of knowledge, education, inspiration. You are the queen of Medicare and other red tape. What call to action would you like to leave for our audience and listeners today?
Yes, everybody, please don't wait until the last week of annual enrollment to call for help. There's 60 million people that's on Medicare. And so please call now. I mean, right now we're booked for like 2 or 3 weeks out. That's getting scary. That is getting scary.
Yes.
So if you want to have your plan compared, if you think there may be something better, or you tried to do it yourself and you're not sure about your decision, then go ahead and give us a call. Now, the way we get paid, and I forgot to mention this earlier, is all of the companies that we're contracted with pay us a standardized commission. So we do not have incentive to put you with this company or this plan or this one or this, so forth. Okay. So what we do is we take your information and we compare all plans that's available to you in your service area.
Absolutely. And, Bonnie, what I love the most is, and I always seem to be attracted to heart-centered people. And you are definitely a heart-centered individual. You always do what's right. And you do your level best to serve others first. And that is so important in any relationship that you have, with people. And I can't thank you enough from speaking from your heart today to our audience and our listeners. And one last time, please tell our audience and listeners how they can get a hold of you. It's a complimentary call that they can have with you, right? And to compare what they have now. And what is the deadline for open enrollment?
The deadline for open enrollment is December the 7th. Please call now to get on the calendar. Okay. I have lots of agents. We're in several states. So you probably will not get an appointment with me, but just know I have trained every single one of my agents. If they ever have a question, they always run it by me. I may have actually chosen the plan and they're just being the ones to actually write your plan. It's just, I have found that I can help many more people by having this little army of agents who can actually explain your plan and write your plan. But I mean, who knows? You may get an appointment with me.
Well, Bonnie, it has been such a pleasure and an honor tonight to host you on the radio show at WCEG Network. We want to thank our network and Global Legacy Wealth Building and WCEG Network for this platform. And we just wish you a wonderful and blessed day. We wish you a happy Thanksgiving, and especially our audience and listeners. And we encourage you to get out there and serve others first. Thank you, Bonnie. Have a wonderful and blessed day. And thank you and happy Thanksgiving to everyone.
Thank you, Celeste.
Thank you.